I think it's time now to open the discussion to the public. So I invite you in this room, and we have another room at the right to give your comments, pose questions.
I start with a comment because it links directly to what Luca said. I would add another aspect to the stigma problem, and it's the aspect of being told, being prescribed what to do at work, which is usually it's like we assume that it's okay nowadays because of the liberal myth of this abstraction of our labor power from our bodies, that it's okay when our bosses tell us, for example, if you're an academic, to work and write this article and give it on one day. But it becomes more clear in the case of sex work that if you're told how many clients you have got to do a day or what services to perform with one client, that is not okay. And the sex worker movement recognizes that pretty well. And this is a tension because we live in neoliberal capitalism. So this is one comment. And the question is quite more concrete, and it refers to what Bogi was saying about the possibility of having alliances with whom, and you mentioned social work, and there I was like, because you were being positive about it. So I am working in an organization which has got a counseling center, outreach center, is led by sex workers, but the counseling center is made 90% by social workers. Some of them has got sex work experience, but the minority. And I encounter in Germany, where I'm based, quite the opposite. So if I look at other organizations, and what is happening now is that more and more social work organizations are becoming abolitionists and are becoming Catholic, and just this is the tendency. And the self-organized ones that were born in the 80s from sex worker movements are being targeted as you only work for the privileged sex workers, the ones who decide we will save the others who are the poor victims. Yeah. So this is the situation that it's now in Germany, and historically in Western Europe, I'm going to talk about Western Europe because I'm asking you about now what is the difference with Eastern Europe, if there is one. There is more of a tradition of Catholic and religious groups providing social work. Yeah. So and they're traditionally also saviors. Yeah. And I was wondering if it was different, and I was wondering if there was pretty much like state-funded social work in Eastern Europe. Sorry for taking long time. Eastern and Central Europe, and
it's fine. After Europe. Should I answer or
we can maybe collect more questions?
The Slovenian NGO Huge directly opposes the amnesty's support of decriminalization because of the relation of decriminalization to increase in trafficking. I also mentioned the fact that in Australia and New Zealand they noticed an increase in illegal activities, which is the illegal sphere is a few times bigger than the legal one. So how would you prevent the pimps and other criminal networks from exploiting prostituted people? Maybe the sex worker unions could do the work of the pimps, actually, maybe. Like the organizations would be non-profitable, and they would provide services like housing, administration work, finance, health, and so on. So it would prevent the prostitutes' dependence on pimps.
Just to add that the Mojca is saying that actually Ključ is not opposing directly the amnesty. So we have seen in the region, I think, many NGOs who work in trafficking and gender-based violence that are indeed neo-abolitionists, so opposing decriminalization. But you are saying that this is...
I contacted them, and they said that they opposed, and they also let amnesty know. So that's my information from them.
Okay, okay. Yeah, so regardless of this, I think the question was clear, so if you can...
I think everyone
And
will...
PGs.
Yeah.
So we take these two questions.
So I will start with decriminalization, if I may. Sorry, PG.
Of course.
Come back to you. So maybe it will be important to define what decriminalization is, because it might not be clear to all of us. So decriminalization is this legal system that was introduced in 2003 in New Zealand, and it's also introduced in South New Wales. It's a region of Australia. And the specificity of this legal framework is that none of the actors involved in sex work, sex industry, is criminalized. And when we are talking about actors, we usually mean sex workers, so people who provide sexual services, clients, so people who buy sexual services, and third parties, so people who organize and facilitate sexual services. And in different countries across the region, as you already hear here, some actor of this relationship, like sex industry, was criminalized. Be it in Serbia, for example, sex workers, clients, and third parties. In Sweden, these are third parties and clients. In Poland, these are just third parties, etc. So the decriminalization model is the situation when the criminal laws are disappearing. Let's cross out the criminal laws in this equation. And what does that mean? This means that and this is not the same as, for example, regulation and legalization, like in, for example, Hungary or Holland or Germany, where there are some specific laws introduced which relate specifically to sex workers and which define how sex industry should be managed and organized. For example, sex workers should undertake medical tests on HIV and other STIs once a month, etc. Or there are only indoor facilities allowed, and sex workers should not work outdoors. Or sex workers should only work outdoors in specific zones, like in Hungary. So in New Zealand and in South New Wales in Australia, there are actually not really any other laws that refer to sex work and sex workers, except so sex work industry is governed by already existing laws on employment, civil code, etc. So there is no exceptionalism for sex workers. With this respect, there are only specific yeah, a bit, but we'll come to that in a second. So there are only specific laws on occupational health and safety. So there is a specific set of rules which say how sex workers should, like sex work venues should be arranged and organized so sex workers can work in safe and health conditions. There is one, and coming back to what you said, increase in illegal activity in New Zealand and Australia. We have, like I guess none of my colleagues here, we have never encountered any kind of research and data suggesting that there is any kind of increase in illegal activity in New Zealand and Australia after the implementation of the decriminalization. Actually, there are reports that suggest that there is a decrease in trafficking, but actually in New Zealand they rather suggest that they have problems with trafficking in the field of agriculture and fishing, bigger than in sex industry. And there is just one issue which is important with respect to New Zealand, that migrant sex workers are not able to work in officially in this decriminalized context. So there might be, but we don't really know, like there is not really any research around that, I think. There might be clandestine underground labor market where actually migrant sex workers work, but we wouldn't know.
Yeah, so I mean, deeming something illegal and legal is very arbitrary according to some state laws. And I also want to add that pimps should not be considered criminals. We refer to them as third parties, and they can be and like from receptionists to taxi drivers to brothel owners, sauna owners, whatever, whomever is facilitating our work, and they are very helpful sometimes, sometimes not, but for sure it isn't helpful to criminalize them. And at least in Romania the term pimp is also very racialized and linked to, I don't know, the criminalization, especially for Roma communities and white supremacy.
But I just wanted to say, I'm not sure which research you refer to about like New Zealand and the increase in illegal activities, but on top of my head I can refer to the increase of Thai massage parlor in Sweden since the criminalization of clients, or the recent report in Norway that there's been a highest number of victims of trafficking in Norway since the criminalization of clients of sex workers. But I never use these numbers because I don't believe in them, and you shouldn't believe in them either. Like most of the research done on sex work and trafficking, when it comes to numbers, like be really, really suspicious about them. The baseline is that there is no evidence that a change in legal framework increase or decrease the number of sex workers or victims of trafficking. That's where the science is at now, if we're talking about science. There is no evidence that decriminalization or criminalization of clients increase or decrease the number of sex workers and victims of trafficking. There is definitely evidence from the police in Sweden that the number of brothels, of Thai massage parlors, have tripled in 5 years or so after the criminalization of clients. That's a fact. But it doesn't matter. It doesn't matter because we don't say this has increased because of the criminalization of clients. There's hundreds of reasons why people go in the sex industry. And the main reason is that people need to make a living. If you want to look at the number of increasing number of sex workers and exploitation in the sex industry, you should look at the economic causes. And I think in Europe and around the world at the moment, we've got lots of concerns about reasons why people are going in the sex industry, which is increased austerity, etc., like destruction of the welfare state for states which had a welfare state to start with, and all these issues are concrete issues that push people into poverty and into sex work. That's much more simple to understand than trying to make correlations that are not scientific between a change in legal system and an increase in trafficking. Look at the numbers and who counts the number of trafficking? How do you find them? Who reports them? For example, if you look at the EU statistics about victims of trafficking, it says something like 65% of traffic victims in the EU are for sexual exploitation. Okay, and that when I meet with people from the EU, they always come up with these numbers, which I don't remember because they're fake. But and they come up with these numbers like, no, but there's really a big problem of trafficking for sexual exploitation. But for example, France only report victims of trafficking in sexual exploitation. In France, we don't count any victims of trafficking in agricultural settings or the factories or etc. or in cannabis farm etc. We don't count them. We just only count victims of trafficking for sexual exploitation. Therefore, these numbers are just not reliable. And I think you have to be really, really cautious when you use numbers to back up your your claim, because anyone in I hope so, in the abolitionist movement or anti-trafficking movement or sex worker rights movement want to see victims of sexual exploitation protected and rescued, if we have to say the word rescued. But but using wrong research and wrong evidence to back this claim is actually very dangerous, because the reason why people go in the sex industry, we talked before, is basically economics. People are coming from global south or other countries to work in richer countries, to work in the sex industry to make a living, and they will use whatever is available to them to work in the sex industry, and that often means for people who are not legally allowed to cross the border, go through traffickers or smugglers, the same way refugees are doing at the moment. They will pay, and often they are not the poorest, they will have to have the money to pay a smuggler in the first place to come here. But the more you tighten the border, the more you give power to the people, and the more you make it difficult for people to cross the borders, the more you give power to these third parties, these traffickers, these smugglers. And the same with the sex industry. The more you push it underground, the more you give power to people who are ready to risk prison or criminalization to facilitate and take a big profit of sex workers earning. That's why decriminalization is so important, is because it gives power back to sex workers to fight exploitation in our own terms. And that's it.
Just a very brief comment. It might not be true for everything, but at least from this research that we've done, these third parties are not necessarily part of the story. All of the male sex workers that I talked to, none of them had a opinion. All of them self-organized. So, I mean, the third parties are not necessarily part of the story. Interestingly, one of them was self-employed but worked on something else. He was selling art and do sex work next to it because of the situation.
So talking about what I was referring to social work, actually I was referring to those times before the present government, but there was social work provision, because now basically there is none, especially in the field of health. So Hungary is one of the few countries, I think, in Europe who doesn't have a current HIV/AIDS strategy in place for 2-3 years now, for instance. And like all the funding basically was cut to needle exchange programs, to any kind of harm reduction organizations, which I was referring to when I said that they are like really powerful allies. They are still there doing some limited stuff, but not state funded anymore. So basically how I see it, like there's like two groups of organizations working on social work in one way or another. Those who are working with us really closely. And what I mean by that, they always employ social workers who are sex workers. And why is it like that? Because social work in Hungary used to be, now it's non-existent, but previously used to be like a really precarious work, actually. So there were a lot of social workers who were also doing sex work. So it was never really, you know, like something hard for us to do, to sensitize them, because most of them, they had sex workers in their staff, like current sex workers as well. So yeah, I think we always had a good collaboration with them, and it's not like in Germany where there's like all these church-funded religious Christian groups that are like running like huge anti-trafficking projects. I know from Germany it's like the civil society is like really not that much secular. In Hungary there's one or two who are working with victims of trafficking, but wouldn't work like, you know, with needle exchange programs, of course. So yeah, they are opposing our agenda quite to some extent, but like all the rest of civil society, social work, health organizations, I think they are all supportive in Hungary.
So I have a comment and a question. Just with respect to this allegation that in the New Zealand, since discrimination, there is more exploitation in terms of the third parties, where actually from the research I have done recently, third parties do not almost exist in New Zealand. Except maybe in street work, but this is minors, mostly boyfriends or friends, but there is no pimp anymore, really, since the decriminalization. With this, the bad pimp kind of idea. But secondly, I'm wondering about why do you call Slovenian policy decriminalization? And thanks for explaining the terms, I think this was probably useful. Because as far as I understand, in Slovenia, the only thing you decriminalized is what was common in the former Yugoslavia, is engaging or falling into prostitution. The law from 1977. Be careful not to fall. Anyway, so as far as I understand, so this is the provision that was abolished, but you still have a criminalization of the third parties. So why do you call it the decriminalization? And is there any movement towards the full decriminalization? And how do you do it in the countries where you don't have organizations, which is a common feature of Slovenia and in Croatia? Who is there to lobby for it when there is no organization?
I'm Mitya from Legebitra. I have one clarification and one question. The clarification is regarding the pre-exposure prophylaxis. Because I work also in the HIV/AIDS prevention, I don't want to enter in the discussion because it's very complicated. But it's not, the clarification is not just giving a pill to a healthy person, because also we have to remind that also contraception is giving pill to a healthy person. It's very complicated, and we are working on it, but I'm really interested in the negative aspects, because we don't want to fall into a trap or something. The question is, because I work as a LG activist, I would like to know how you can become a good ally. What should you do? Also regarding sex work of MSMs.
I don't have a question. I am from the Abolitionist group. So my point of view is that sex work it is a very heavy, very dangerous work. But if we count it as work, then we accept that the human body can be solved in this way. It's a very difficult issue because we sell our bodies in other work too. If you work in the factory or if you are a garbage collector, it's also very dangerous. But it's a different kind of work. because it goes so deeply into our personality, into our individuality. I cannot accept it this way. Another thing, which it's not about morals. It's not that I think that prostitutes are morally whatever to be judged upon. It's not about that. And it's not also always that they are victims, because they are not always victims. There are some who choose this to do. So I admit all of it. But I think that the vast majority are in the economic situation that they cannot refuse to do it. It is the only way out for them to survive. So I think that women in the women's movement, either are we on your side or on my side, we have something very in common. We think that we have to do everything to help these women out, not to be in the situation if they don't want to be prostitutes, and they are because they don't have a choice, that they can get out of it. So the question, either we criminalize or decriminalize, for me, is the question, do we help them or we do not help them to get out of it with this? This is for me the main question. And I don't have the answer, I have the question.
Has the issue of sex work and disability been addressed on European, on any other level?
Okay, so I can just shortly address the issue of PrEP. So pre-exposure prophylactics, very shortly. So yeah, there are a lot of concerns within sex worker community around PrEP because we are worried, and given the close reading of the WHO recommendations, it might be actually the case that PrEP will be prioritized over other forms of HIV prevention, including condoms. And this is our huge concern, especially given the founding tendencies without HIV frameworks which prioritize medical interventions over any other form of prevention. But I think we can really talk about it over coffee. I just wanted to make a short comment around abolitionist issues. So yeah, absolutely, a lot of people work within enter sex work because of economic reasons. But I think that there is one thing I usually struggled with. We live in late capitalist society. A lot of people, I would say vast majority of populations actually are facing poverty or are endangered by poverty, and actually economic coercion, as abolitionist movement usually frames it. So the fact that people need to earn money to survive is something experienced by almost everyone, basically. And this is a question. This is the problem I have, that it's being in some way exceptionalized when it's being discussed with reference to sex workers, because actually, like, I don't know, you mentioned garbage collectors or some other workers like blue-collar workers, but most of the people working in services, in academia even, work because they need to earn money to survive. So sex workers are not any different. The difference might be the stigma, of course, and the fact that people who start doing sex work might have limited options, like Luca mentioned, for example, trans women in Turkey who just don't have access to other labor markets. So I don't really, I have a trouble with this exceptionalization of sex workers as those who are in some kind of like particularly a precarious situation in terms of having to enter a labor market. So, and another issue, just one small comment. So you have your, abolitionist movement has its kind of strategy of addressing this problem. This is rescuing, or whether rescuing women, taking them out of sex work, or criminalizing clients and third parties, though trying to abolish the sex worker, sex industry. But why don't you actually address poverty and structural inequalities that put people in a position to engage in sex work? Because this is not what abolitionist movement is doing from my perspective. like abolitionists across Europe focus mostly on kind of targeting sex workers, rescuing them, with taking them out from their work environments or criminalizing their work environments. But what has to be addressed is the poverty, is the vulnerability of people who have very limited choices and actually enter sex work. So this is my comment.
Just to add, I think there is no free choice under capitalism, as you hinted at, and it's very sad that abolitionists are actually contributing to the punishment of economic resistance of some people.
Well, no, I won't say like but there was many comments. We're going to focus a bit on abolitionism. Like, thank you very much for speaking, and I agree with everything you said. And I think a huge part of the sex worker movement, if not the majority, like the total of the sex worker movement, agrees with your position. And I completely recognize that the majority of sex workers or prostituted people are selling sexual services because there is no other options. And then it brings the question of like, well, is this, a choice then? And I think that's where the question goes wrong. Like, it doesn't matter if it's a choice or not. Like, people are selling sexual services because they don't have other options. So what do? We are calling for decriminalization because we believe, and we believe because it's been evidence as well, that it will be the best way to protect sex workers. And once we protect sex workers, we're able to work collectively, sex workers, with trade unions, with feminists, with LGBT movements, with Roma people, to fight against the core causes that push us into prostitution. Like, Amnesty International position is not just decriminalization, it's calling on member states to look at the causes that push people, like poverty, gender inequality, discrimination. That's what Amnesty International position is so strong. It's not just saying, let's decriminalize sex work and the world will be a better place. Like, no, let's look at decriminalizing sex work and then look at the root causes that push people into sex work. And the main one is poverty. And how do we fight poverty collectively? You need to include sex workers, the same way that the feminist movement has been calling for women to be involved in like social changes. You can't make social changes by excluding sex workers. But the problem is that, and I don't know about in Slovenia, but the abolitionist movement globally is calling for criminalization of clients. And criminalization of clients doesn't work. Now we have criminalization of clients in Serbia. Well, sex workers are still criminalized. We have criminalization of clients in Lithuania, and sex workers are still criminalized. This is happening as criminalization is criminalization. Yeah, maybe sex workers will be a bit less, be better off in Sweden than in a country where everything is criminalized. But you give power to the police. As a feminist movement, giving power to the police, these are men with guns, with sticks, who are racist, sexist, rapist pigs. Like, that's the power we give to these people. And we are saying, like, we are a women's rights movement who believe that the police is the best place to save women. That's really problematic. And I know not all abolitionist movements are like this. Like the sex worker movement, some part of the sex worker movement is, for example, calling for universal basic income. Let's look at what are the possibilities for people not to go in the sex industry in the first place. Like, you want to get people out, I want to stop people getting in.
Here we are.
Yeah? But like, and I think that's the difference. Like, you can't use like the police and state control and migration control to rescue people who are often, women, migrant women, drug users, trans women, etc.
I just wanted to say there has to be a limit to what can be done even in neoliberal capitalism to a human body. You know that child work is omnipotent in most of underdeveloped countries. Are we for the child work? We are not. We want them to stop this because it's harmful. It's causing damage we cannot really repair.
Maybe in some places it was found that criminalization of clients gives the prostitutes more power over them because they are able to report them to the police. It was found in Canada. The second thing is the prostitution is the only work that involves body invasion, and it is traumatic by itself. Then it's impossible to ensure full health protection. In other work, protection from infection and such is obligatory, and in prostitution it's not possible. You would have to wear a full body condom, as I said. And the third thing about exiting prostitution. In Sweden, the measures are education for people who want to exit, and not just education in hairdressing and stuff, but education in work that will actually bring them some pay. So it's not just taking people out. Thank you for giving me.
There's a recent report in Norway that is a governmental report, so it's a report written by the Norway government, who's been like criminalizing clients for a while, and they are trying to show that it's working really well. It actually says in the report that street-based sex workers are less likely to report violence to the police now that the clients are criminalized because they don't trust the police. And we're talking about Canada and Norway, which are like some of the richest, liberal democracy or whatever you call them, where actually the police is not the main perpetrator of violence. But around the world, police is the main perpetrator. The police, as I was saying earlier, is corrupt, is stealing money from sex workers, is raping sex workers in countries, from India to Kenya to like many other countries where sex work is much more prevalent than Western European democracies. So I think it's really problematic to use, the quote from one police officer from Toronto to say that basically this is helping sex workers. Like the evidence is that criminalizing sex work is not supporting sex workers, and that's why Amnesty International, who I think is a pretty big organization and quite serious, and has done a bit of 3 years of research about it, looking at the evidence in Norway, in New Papua Guinea, and in other places, that actually criminalization doesn't work. Giving power to the police does not work, does not support marginalized women, street-based sex workers, trans women, sex workers who use drugs, Roma sex workers. That's the basic thing. That's just as simple as that. If you still believe in the power of the police, then it's difficult to have a more in-depth conversation. About wearing a full-body condom, well, now we have PrEP, it's not really necessary. But the problem is, do you know what is the main cause of death around the world? It's work. Work is killing people. That's the main cause of death around the world. It's not suicide, it's not murder, etc. People are mostly dying. I don't know the numbers, you can look at the international trade union movement. Several million of people a year die of work, because work is dangerous. And when you're poor, and when you need to make a living, when you need to pay for your kids' food, to put something on the table, you take a work that is dangerous. So your whole thing about, it's traumatic, it's not traumatic, I'm not an expert in traumatology, I don't think experts are experts about other people's life when it comes to sex work. I think this is when it's getting really difficult to have a debate, rational debate, when you actually say that we are basically all traumatized here who've been selling sex. I think society is being traumatic. There's lots of reasons for people to be traumatized, including having to work in any kind of circumstances. I think just saying that sex workers are basically traumatized and we shouldn't listen to them basically, because traumatic victims don't know what they're talking about is really offensive. And the final point, I didn't try. Maybe I just jump to the PrEP. Or you want to respond? We're going to be stuck in there.
There are other questions.
Handicap.
Disability.
No, sorry.
I just want to say that, I don't know, either if it's sex for money or sex for whatever reason, for other exchange, like food, housing, all kinds of interests, including love. I think the criminalization of sex work actually goes into what are our views on the body and what should intimacy look like or not. So it's part of a very regulative system, and I love pattern invasion.
So yeah, it's a bigger debate, but at the global network of sex work projects, I made a consultation with sex workers around the world to see what would be the issues with PrEP. So PrEP is being kind of rolled out as not an alternative, complementary, solution to stopping HIV. But the thing is, for many sex workers, it's seen as it could be actually quite problematic for many reasons, including the fact that my main concern, you can read the global report. My main concern is that in many countries, sex workers don't even have access to condoms. I've been having meetings with sex workers from the Asian network of sex work project, from African sex worker project. They just don't even have access to condoms. There's no condoms in their countries. And now at the global level, they're talking about the PrEP, as this would be, an efficient way. And it's not listening to the main demand of the sex worker movement, is that we want more community-led services. We want decriminalization. That would be a massive, a way to prevent, HIV transmission. Decriminalizing sex work, so sex workers are able to carry condoms and not having the condoms taken as evidence. We're just a bit suspicious that PrEP is being rolled out as this kind of new tool without really taking into account like the sex workers' concerns about it.
But you didn't answer my question about the ally.
Okay.
So maybe Bob can take this question.
Oh, which one?
About the alliances between LGBT.
On PrEP, I think it also this push for PrEP and what's beside it with the whole pharma industry, but it also reduces HIV to an individual problem. And there are more structural factors, decriminalization as well, but considering the high HIV prevalence in Eastern Europe, there's also poverty. There are reasons to take into account. So it's problematic.
So we are worried by the biomedicalization of the HIV epidemic. So the pills are the only focus right now, not the structural factors that contribute to people's vulnerability.
Okay, my answer is simple. Go on to the website of ICRSE and you will find a briefing paper on how to become how to become an LGBT organization which is sex worker inclusive. I think it's a really good resource. I wrote it. That's the first step. But generally, what we see in a lot of cases with LGBT organizations, I think in a lot of countries, is that they want to kind of reinvent the wheel when they try to reach out to sex, or they try to initiate a health project for LGBT sex workers. And I think the first step is really to understand the issues on the global level, to understand the concerns of sex workers in the given country or globally, and listen to them and involve them in a meaningful way. So I think these are the key things when you want to be a good sex worker alive.
Just a mean thing about being an ally, and not just for the sex worker movement, but more like marginalized movement. When you want to be an ally to a group that you're not a member of, it's really just listening to the group. There is lots of information out there written by sex workers, and the global network has membership in many countries. I was saying earlier in Africa, in Asia, in Latin America. The sex workers are speaking for themselves. I think the problem with this rescue feeling that many of us have, I also want to rescue people who I feel are vulnerable. That's a quite natural, I think, feeling, but you really have to question why you want to support an organization, why you want to support a group. Is it coming as a feeling of rescuing, of pity, or you know better and you want to help them, or do you want to be as an equal? And what we need is equal, because we are the same as other organizations, other members of society. We are workers, we're LGBT, we're women, we're migrants, etc. So what we need is people who can work as allies with us, but as equals. I think the same with the refugee crisis. It's not looking at how can we save them. It's well, no, just sit down and listen to us and talk to us as equals and see what we can do together, because it really depends on each situation. In some countries it might be that the LGBT organization has an office and sex workers have no place to meet, and it will be renting the office, landing the office to the sex workers. It might be organize a campaign with them, helping them develop their organization, but always by treating us as equal and not by people that need to be rescued.
And there was also an issue of disability that was brought up. I'm not really sure how to answer your question because there are so many topics that we could
Mrs. Ling is away probably, but the question was whether this has been addressed on European level or at other. We know Dutch and UK experience, but in the region or in Europe?
In the region, when we are talking about Central Europe, the Balkans. So I think Hungary has a debate over sexual assistance right now, and it has been also discussed in Czech Republic. So actually it's interesting because Czech Republic is at the same time discussing the new legal framework to legalize sex work in quite barbarian terms. So, but they are discussing it, and the sexual assistance team kind of appeared within the framework of this debate about legalization as one of the kind of legitimating arguments. This is more or less, I know there are different initiatives all across Europe, but when we are talking about this particular region, the sex work criminalization is so strong in most of the countries, like the Balkan countries, that this is not really brought up. So in the context of legalization, or where legalization is being discussed, yes, the category of sexual assistance is being discussed in practice.
And who advocates for change when there is no sex workers organization?
I think it's not just about the of course it's about the sex workers themselves, but like any other organizations, you know, can reach out to individuals, or there must be someone out there. So one still, you can reach out to that person. Maybe that person knows someone. So I think it's really important quality of an ally to be this like equal, like creating these equal opportunities between them. Yeah. So I know it's really hard, and like it's not less, you know, harder when there's like a big community. So facilitating kind of like the consensus on what legal model to advocate for. So yeah, so both of them have like really like obstacles arising from them, I think. But the first step is to, you know, be in touch with the global sex worker movement, or regional or European. I think that is really helping already, you know, how to address the situation locally, and then bringing onto sex workers. This is the only way I see.
Even just briefly on the decriminalization, the Slovene context was that actually the Social Democrats in 2003 removed sex works from the misdemeanor. So, but the criminalization of clients, third parties, continues to be there. So you're right. I mean, we should question what does it mean. But Slovenia in that context 13 years ago, and I think even now it's still. So it's you mentioned Serbia before. So countries moving toward the punitive approach. This was one step. But if you ask me now, 13 years later, this wouldn't happen, I think. So, and I think that the problem with Social Democrats was they didn't push enough. So they opened the door to moralization, to this law on public order and peace act, that actually 3 years later, after the decriminalization, brought in the prostitution as immoral behavior. So yeah, you're right on that.
In fact, I want to add something to what is said about trafficking and sex work. Figures on trafficking are notoriously unreliable, like Luca said. I'll just introduce myself. Sorry, Marianne Weijers. I'm from the Netherlands, and I come from an anti-trafficking background. So, figures on trafficking are very unreliable. But what I do know, that when I worked with trafficked women, which I did for more than 12 years, that my clients could be abused with impunity because they were women and often had, you know, less rights in the countries they came from, because they were mostly undocumented migrants and because they were prostitutes. So that's why I got involved in the sex workers' rights movement, because I truly believe that rights are the best protection against violence. And what we do know, that if we criminalize sex work, clients, sex workers, that you increase the stigma and that you make people more vulnerable for violence and abuse, including abuse of the police, what we've heard. About choices, I always find it difficult. I remember a Thai sex worker saying to me, okay, some people may be able to choose between 20 pieces of cake, and I can only choose between 5 pieces of cake. But I still make my own choices, and I still want my own decisions to be respected. So even if people have less choices, and even if we would like a world where people and women have much more choices and opportunities than they have now and than we have now, there is absolutely no reason to punish people for their lack of choices, which is what we do if we criminalize sex work.
Thank you. I'm Daria from Ljubljana. I think it's there is an interesting distinction going on between, if you look at the sex workers and the discussion about sexual assistance in the area of disability. Well, all of the countries of Eastern Europe, I think, except Belarus signed the United Nations Convention of the Rights of Persons with Disabilities, and within this convention, people with disabilities have the rights to have sexual life, but they don't have sexual partners. So in many countries, sexual assistants are replacing the more ordinary, I don't know, sexual relationships. For me, what is interesting is that they are not called sex workers most of the times, but sexual assistants. Secondly, what is interesting for me while looking at the interviews with them in Austria and in Germany, was that they say they decide what they do, I mean in the sexual terms, while the sex workers are most of the time exposed to what the client wants. So, I mean, I think it's really interesting. And the third thing that I think is interesting is that it seems to me that people accept sexual assistance easily because there is a kind of a help here, a kind of a thing that you can feel better physically and emotionally if you have the right to sexual life, while sex workers in ordinary context is more, it's connected with pleasure and enjoyment and personal choice, so it's much less socially acceptable. So I just want to see what you think about that. Thank you.
If I may, I just think it reproduces a lot of stereotypes and stigma around sex workers, this kind of framing of sexual assistance versus sex work. Because the sole fact that sexual assistants will call themselves and are being called sexual assistants is pointing to the fact that they want to, they are to be distant from sex workers. Because sex work is so much stigmatized that creating this new occupational category requires this reframing of language that is being used. So yeah, it points out actually to the level of stigma experienced by sex workers. And another fact is that, and I think our colleague PJ might have a lot to say about it, as she researches stigma around sex work and also stigma around the client. So we can see really how stigmatization of clients plays out here so well. So there are these vulnerable clients and there are these oppressive clients. We have this total polarization of the image of the client, the lustful, full of desire, aggressive, heterosexual male client, right? The regular client. And then the client who is with disabilities, who is so vulnerable, who needs to be taken care of, and this is totally justifiable. I mean, this is interesting how sometimes reference to sexual assistance and meeting needs of people with disabilities. This is the only way how to introduce sex work in a debate over actually sex work in different countries where sex work is totally accepted. But yet this is still reproducing the same old stigmas we have and stereotypical images of clients and sex workers we do have.
Thank you very much to everybody, to the panel, to the public. I won't make any final comments, just it was very inspiring for me. And let's continue discussing, let's continue listening what sex workers are saying.